Hey, welcome to What Is section of my channel. My name is Dr. Hashmi and today we are going to discuss what is osteoarthritis. Osteoarthritis is a dreadful joint problem and it fades all charms of life for its sufferers. People who have this condition can tell that most of the time it doesn't respond to any painkiller effectively. It limits mobility and independence. It pushes patients deep into the darkness of depression and despair, especially those people who were previously healthy, active and independent. Arthritis means inflammation of joints and osteo means bone. So this condition mainly affects the joint cartilage and the bone tissue next to it. Severe wear and tear to the joints or any problem with the normal repair process causes inflammation and abnormal bony growths called osteophytes. As a consequence, the joint space gets damaged and narrowed. Severity of the condition depends on the extent of narrowing. It is quite common. It affects around 6.7 million people in the UK, and I think total population is around 67 million. So this affects nearly more than 10% of the population. It's quite common and there are multiple factors that are associated with osteoarthritis. Theoretically, a typical patient is an aging woman who is overweight with previous history of joint infection or fractures. Let's not ignore the role of genetics and sometimes unfair odd nature's injustice, because there are many people who have this condition and quite severe one. They don't have any of the risk factors and it's quite frustrating at times. So the concept behind this is that the blood supply to joints, and in some cases under stressed joints due to obesity, becomes quite less effective, and it gets worse with age and previous insults in the form of fractures or infections, and they act like a cherry on the top. This problem presents with pain, stiffness, swelling of joints and limitation in full movement of the joint. It can affect any joint, but most commonly it affects hips, knees, fingers, thumbs and lower part of your spine. This is a brief introduction to osteoarthritis, and I think at this point you know enough to buzz your doctor, because it's quite important to have this consultation if you're suffering from these symptoms, because you can limit the progression, and believe me, in later life it can really affect quality of life and it can get quite disabling. In terms of treatment, there is no particular cure for osteoarthritis, but there are a number of things that can be done to ease symptoms. Main aim is to understand the condition, reduce any pain or stiffness, maintain and improve the mobility of your affected joints, and to limit any further damage. The best advice for the patients is to do regular exercise, weight control, and there are some special shoes and insoles that can be tried. Your family doctor can prescribe you some painkillers. Some people also go for steroid injections into their joints, and ultimately joint replacement is also one of the options. These are few tools of trade for health professionals. I hope this video provided you a brief summary of osteoarthritis. Thank you so much for watching. Subscribe for more. Cheers.